Hello and welcome. You're watching Trending Tech on NewsX World, where we bring you the latest tech breakthroughs and trends from around the world. Photobiomodulation is a cutting-edge light-based therapy that uses specific wavelengths of light to stimulate cells and promote healing within the body. This therapy works at a molecular level, interacting with cellular structures to improve mitochondrial function, reduce inflammation, and encourage tissue repair. It has shown great promise in treating a variety of conditions, including Parkinson's disease, traumatic brain injury, and kidney disease by targeting the underlying biological processes that drive these disorders. The therapy can also have a positive impact on the gut microbiome, further enhancing its healing properties. As research advances, photobiomodulation has the potential to revolutionize the medicine, providing a non-invasive and effective treatment option for a range of neurodegenerative and chronic conditions that have been difficult to treat with traditional methods. To talk about this, we welcome Ms. Ann Liebert. She's a professor of research at Shepherd University, West Virginia, a research fellow at the Kolling Institute, University of Sydney, as well as coordinator of photomolecular research at Sydney Adventist Hospital. She's a vice president of the Australian Medical Photobiomodulation Association and the board of the PBM Foundation. She is conducting translational clinical trials in Parkinson's disease, TBI, and kidney disease, and experimental research into the mechanisms of photobiomodulation. Thank you very much, Dr. Liebert, for joining us. Welcome to NewsX World. Now, Dr. Liebert, could you explain to our viewers what photobiomodulation is and how this light-based therapy works at a cellular level to potentially treat various diseases?
Thank you very much for the question. So light-based therapy, termed photobiomodulation, is the use of light that doesn't heat, unlike surgical light treatment that is used for cutting and cauterizing. It works at a cellular level to activate the energy-producing part of the cell, which is called the mitochondria, to increase energy availability for cellular functions. This energy is then used for tissue healing, relieving pain, and increasing nervous system activity to improve brain and nervous system functions. And this is especially important where there has been trauma, infection, viruses, metabolic imbalances causing symptoms of disease. These include pain, muscle tightness, and cognitive loss. It stimulates the cell when there is inflammation that is not resolving, and it suppresses inflammation where there is inflammation in diseases such as chronic pain and Parkinson's disease.
In your photomolecular research, what have been the most surprising discoveries about how light interacts with molecules in the body, and how does this lay the foundation for new medical treatments?
So the most exciting, surprising discovery that we found is that more than 10 years ago, when I was working at Sydney University in the lab with some professors, Professor Stone and Mitrofanis, who were working on relieving Parkinson's disease in an animal model. So what they found was when they blocked out the eyes and only did the treatment on the abdomen, there was as much relief of the Parkinson's as treating directly the brain. So my husband, who's a microbiologist, Dr. Brian Bicknell, he said at the time, I think, Anne, what you're doing is treating the microbiome. So very surprisingly, we did the experiments again. We put the light on first, and then we did the experiments just on the abdomen. At the same time, he measured the microbiome to see when the mice got better, was it the microbiome that changed at the same time? And it was. We published this, and this was very surprising to us. And that's when we started to look at the mechanism, as part of the mechanism of the microbiome being an action of the light.
Your work on photobiomodulation for Parkinson's disease has shown promising results, including changes in the gut microbiome. Can you share how this therapy might improve symptoms for patients living with these conditions?
So we have now completed 4 clinical trials using photobiomodulation in people for Parkinson's disease, as well as the fact that I've been using the treatment for many years in my clinic as a clinician. What we have found over both of these times is that the symptoms have improved and sustained for more than 5 years in a large percentage of the patients. The symptoms that we have seen improvement have been motor symptoms like mobility, walking and balance, as well as fine motor skills such as writing. And more importantly, we've also seen improvement in Parkinson's disease in non-motor symptoms like improved cognition, improved sleeping, improved quality of life, and in the improvement in the sense of smell. This is particularly encouraging for us because there is no other treatment that so far that has been able to help regain the sense of smell. And losing the sense of smell can be one of the very early indications of Parkinson's symptoms, preceding the other symptoms for many years. And so we see these treatment as potentially having new improvements and sustained improvements in Parkinson's disease. And we've also seen that there is a possibility that is the microbiome that is driving this. And over the new year, we have just published a paper describing the changes in the microbiome in our patients that improved all these symptoms.
For individuals suffering from traumatic brain injury, how does photobiomodulation address inflammation and recovery based on your clinical trials?
So photobiomodulation is very good at resolving inflammation and neuroinflammation. There have been a number of studies on traumatic brain injury and post-concussion injury and post-traumatic injury that have been reported. And they often, these conditions can lead on to something called chronic traumatic encephalopathy and also Parkinson's disease. The important thing with traumatic brain injury, and this is my clinical experience as well as other studies, that if you address the traumatic brain injury early with photobiomodulation to the area of head and traumatic neck, then you can resolve the symptoms and don't have some chronic neuroinflammation that will prevent this condition going on to more permanent brain loss. Interestingly, 40% of people that are homeless in America have had a traumatic brain injury. So it's very important, whether the injury is happening in sport or trauma or car accidents or blast injuries, that you resolve the treatment using the symptoms using photobiomodulation early on to prevent the chronic inflammation that leads to more serious illness.
Thank you for sharing that. And now bringing kidney disease into our conversation, what role does photobiomodulation play in suppressing oxidative stress and inflammation in chronic cases, and what outcomes have you observed in your research?
So in our kidney research, and have to say that we have not started any clinical trials. We hope to in this new year. But in our, so far, our preclinical trials, we have seen there has been a reduction using photobiomodulation at the right level over the kidneys in oxidative stress markers and inflammation. And in end-stage kidney disease, there's often a lot of scarring and fibrosis, and we were able to demonstrate now in both in a single-cell model and in a clinical model with mice that's been repeated, that the chronic inflammation and fibrosis was reversed. And as it was reversed, the markers for improvement in decreasing oxidative stress, improving antioxidant markers, and in improving the upregulation of genes that help in collagen and in the cytoskeleton, which is the wrapping of the cells, were all increased. And this was sustained over time. And these results are so encouraging for us that we're going to start this with a human trial, and then if this is successful, this will be able to be a very good adjunct treatment to help in the early stage kidney disease to prevent progression. That will be our aim.
How do you envision photobiomodulation evolving as a treatment option for neurodegenerative and chronic conditions like Parkinson's, TBI, and kidney disease on a global scale?
That's a very interesting question. I think we're at an inflection point right now for treating these diseases. Current treatments haven't worked for these diseases, and we are seeing very good results with light therapy. We see light therapy as potentially a universal treatment that patients can administer themselves in their own homes and take control of their own treatment with good effects. In the same way that international guidelines for using photobiomodulation for the reduction of side effects of cancer treatment, I anticipate that there will be development of guidelines for treatment for chronic conditions such as kidney disease, neurodegenerative diseases such as Parkinson's as well. And the evidence is now increasingly that we should be able to implement these global guidelines. And in the future, other chronic conditions like kidney disease and other metabolic conditions, we will be able to implement the same treatment guidelines when the evidence exists.
Thank you, Ms. Anne Liebert, for joining us on this episode of The Trending Tech. With that, it's a wrap on this episode of The Trending Tech. For more tech updates and innovations, stay tuned on NewsX World.